Hi everyone, Dr. Lindner. This is a continuation of the muscles of the lower extremity. In a previous video, we covered the muscles of the hip and the thigh. We covered them from anterior, posterior, medial, and lateral, all different views. And now we're looking at the lower leg and we're going to address it in the same fashion. When we talk about the leg, we're talking about the tibia and the fibula. And there are muscles that we can see in the front view, a little bit on the posterior view, and then we'll look at the lateral view as well. So in this picture, we're looking at the anterior compartment. The anterior compartment is just a sophisticated way of saying muscles in front of the leg. That's it. So the concept here is very, very similar to the muscles of the forearm. There are muscles on the anterior forearm that are going to cross the wrist. And when they cross the wrist, it flexes the wrist. And then there are muscles on the posterior forearm that cross the wrist. When they contract on the posterior, it moves the wrist posterior, which is wrist extension. So apply that concept to the leg. We can clearly see that there are muscles on the anterior leg. These are the bellies of the muscle, but you can see that they cross the ankle. So these anterior muscles that cross the ankle, at the ankle, they will dorsiflex. They will dorsiflex the foot or the ankle. And some of them cross the toes. You can see the tendons here on the toes. And those muscles originate on the anterior leg, cross the ankle, and attach to the toes. Well, what do they do at the toes? They will be responsible for toe extension. Okay. Now, toe extension is the same thing and interchangeable with the term toe dorsiflexion. Okay, because dorsi means dorsum, it's in the back. This is the top of the foot. It's actually called the dorsum of the foot. The bottom of the foot is the plantar surface of the foot. So it's either toe extension or toe dorsiflexion. They're interchangeable. Let's look at the three main muscles that we can see superficially. The most medial muscle, number one right here, is the tibialis anterior. And the tibialis anterior is your primary foot or ankle dorsiflexor. It's your foot dorsiflexor. You can see that it originates on the anterior tibia. It comes down and inserts right here on the head of that first metatarsal. Since it is a medial muscle, you can see that it's medial, it dorsiflexes, but it also inverts. It also inverts the foot. Go back to the PowerPoint. If you forgot what it looks like, I did that video on ranges of motion that show foot inversion and foot eversion. So make sure you make the time to go back to what those actions look like. Again, it's the basic principle, the muscles in front. So it's going to move the foot into the front. That's called dorsiflexion. And since it's medial at the attachment, it pulls the sole inward, which is foot inversion. Then right in the center, we'll call this number two right here. That is the extensor digitorum longus. It's superficial. You can see the tendons going to digits 2, 3, 4, and 5. That's the extensor digitorum longus. What's the action? Toe extension. Simple. Toe extension. 2 to 5. 2, 3, 4, and 5. So what does the first digit or the great toe? Well, it has its own called extensor hallucis. Remember, hallucis is the great toe. Extensor hallucis longus. We can see the tendon. Can we see the belly of the muscle? Not really. We would have to take number 2. We have to take the extensor digitorum longus, dissect it. So you can see right here, there's a slit So we can take that and we can pull it away. And when we do, right, here is the extensor digitorum longus cut away. Here it is, right? There's the extensor digitorum longus. We cut it away so we can see what's deeper to it. So here is the extensor hallucis longus tendon right here. And here, if we pull this away, let me outline it. We're looking at this from the posterior. It's on the back side, right? This is the extensor digitorum longus that we just pulled away. But if we pull it away and look at it from underneath, we can see the extensor hallucis longus, right? It says the belly is deep to the extensor digitorum longus. Here's the extensor digitorum longus, and this is deep to it. Okay, so what does the extensor hallucis longus do? It extends the great toe. And this is the one that's involved with bunion formation, FYI. This is involved with bunion formation. Why? Because here is the tendon, the insertion, and the origin is here. So when you look at the direction of the line of pull, it's kind of going, this is lateral, and this is medial. So when you have something pulling in two opposite directions, it's going to bring that great toe in that direction, creating that bunion. Okay, so the EHL, the extensor hallucis longus, is involved with bunion formation. Now let's take the leg, and we're going to look at it from the lateral perspective, or the lateral compartment. Now, there are two primary muscles here. They're either called the fibularis muscles, or they're called peroneus muscles. Peroneus. I learned them as peroneus. So depending on the book, it's both peroneus longus and peroneus brevis, or fibularis longus and fibularis brevis. They're both acceptable answers. I prefer peroneus, and the reason being, when we do neurology, there are nerves that follow this path called the superficial and deep peroneal nerve. So the reason why I like peroneal and peroneus better is it's going to tie into neurology. There is no fibular nerve, but there is a peroneal nerve. So on the lateral side, superficially, let me outline it here. We see this muscle, superficial, called the peroneus longus, or fibularis longus. And deep to it, I'll do it this way, right? So deep to it, we see this, and we see this. Okay? And that is called the fibularis or peroneus brevis. Okay? Now, these are lateral muscles. They attach to the outside of the foot right here, especially the fibularis or peroneus brevis. And since it's on the lateral foot, it does foot eversion. Foot that was horrible. Let me do it again. Foot eversion. Okay, and they plantar flex. They plantar flex the ankle. What does plantar flexion look like? Stepping on your tippy toes, moving your body upward. Okay, so those are the only two main lateral muscles. Now we're going to look at the posterior leg. When we look at the posterior leg, the most obvious and largest muscle that we see superficially is the gastrocnemius. However, the gastrocnemius has two heads. This is medial, this is lateral. So the pinky toe is here, the great toe is over here. Okay, actually, let me take another look at this. Nope, I think it's yep, this is medial, this is lateral, this is the great toe, this is the pinky toe. I think I said it backwards. Okay, so this is the, let's call this the left leg. That would make a little bit more sense. The left leg. So this is the medial malleolus, this is the lateral malleolus, pinky toe, and great toe. So when we look at the gastrocnemius, we see that this right here is the medial head, and this right here is the lateral head. So there's two heads to the gastrocnemius. And deep to the gastrocnemius is a muscle called the soleus. We can see the fibers on both the lateral and medial side. Both the gastrocnemius and the soleus have an attachment site to the calcaneus. And the way it attaches to the calcaneus is by the Achilles tendon. The Achilles tendon is the number one tendon in the body that is ruptured. It's the most common rupture in the human body. And you have to be careful with antibiotics, believe it or not. There are many antibiotics known to cause tendinopathies and to rupture tendons. I've had many patients over the year that have come in, and when they come in and they say they ruptured their Achilles tendon, and I say, what were you doing? And they say, nothing, I was just walking and it snapped. I'll say, were you on any antibiotics a week or two before? And more than 90% of the time, the answer is yes. So whenever using antibiotics, always make sure and double check that there's no associated ruptures with that or tendinopathies associated with that. So here is the gastrocnemius, and it's removed. Here's the gastrocnemius removed, and this is what the soleus looks like that's deep to it. Here is the gastrocnemius. This is the lateral head. And right here is the medial head of the gastrocnemius. And that would be right here. It kind of would sit superficial to it. But we dissected it and pulled it away so we can see the soleus that's deep to it. That's the soleus. And this tendon right here is called the plantaris. Okay, so the gastrocnemius, the soleus, and the plantaris, all three of those have the same insertion site on the calcaneus. All of them are going to plantar flex. All of them will plantar flex the ankle, which is stepping on the tippy toes. That's what that looks like. All of these. Gastrocnemius, the soleus, and the plantaris. All of them plantar flex. Of the three, only one of them, which is the soleus, does not cross the knee joint. So the gastrocnemius crosses the knee. We can see it up here. It crosses the knee. And the plantaris crosses the knee, which is right there. There's the belly of it. We don't see the tendon, but we can see the belly. So both the gastrocnemius, both heads, and the plantaris cross the knee joint on the back, on the posterior, so they can flex the knee and they can actually plantar flex the ankle. The soleus, on the other hand, does not cross the knee joint. So the only action that the soleus can perform is the one at the ankle, which is ankle plantar flexion. Now what we're doing is we are pulling away the superficial posterior compartment. We're going to remove the gastrocs, the soleus, and the plantaris. We're dissecting it. We're going to pull that away. So what we're looking at now is the posterior leg compartment. It says the gastroc, the soleus, and the plantaris have all been removed. And now we're looking at these four muscles that are very deep. One of them only crosses the knee joint. It's a really important muscle called the popliteus. And the popliteus is what I refer to as the key that unlocks the knee. It's the key that unlocks the knee. What is the popliteus? The key that unlocks the knee. What do I mean by that? If you're ever asked the action, you can't put the key that unlocks the knee. That's just a silly thing that I'm teaching you to help you understand. What do we mean by the key that unlocks the knee? In order to unlock the knee, okay, in order to flex the knee, it has to medially rotate just a little bit. When the leg is extended, in order to go from an extension to a flex position, to flex the knee, the popliteus contracts and it medially rotates the tibia just an itsy bitsy bit. By medially rotating it, it unlocks the knee and you can now flex the knee. So the popliteus is the key that unlocks the knee. How does it do that? It initially medially rotates the tibia just a little bit to initiate the unlocking mechanism that allows the knee to flex. Okay, that's the popliteus. Now there are three muscles deep to the superficial. There's 1, 2, 3. The one that's sandwiched in the middle, right here, is called the tibialis posterior. Remember, there was a tibialis anterior in front of the tibia, and there's a tibialis posterior behind the fibula. Then we have this muscle here. Now remember, this is medial, this is lateral. So the great toe is right there. This is the left leg. So this muscle here is the flexor hallucis longus. It's a lateral muscle on the posterior leg, but we can see that it wraps around here, right around the medial malleolus, and is going to attach to the great toe. And the flexor digitorum longus does a similar thing. It's going to come down here right behind the medial malleolus, go underneath the foot, and it's going to attach the toes 2 to 5. Okay, so these are posterior muscles, but what they do is they come around, they go behind the medial malleolus, and they tuck right underneath the plantar surface of the foot and attach on the underneath side. Okay, that's kind of the visual here.